caring before, during, and after pregnancy is vital for the health and well-being of mothers and babies. AtlantiCare offers multiple programs for healthier outcomes, including a special program for pregnant women called Centering Pregnancy. It's all here on the next Latino Motion. Join us.
Choose to get lost in the woods to gain experience in forest management.
Choose to travel through time to understand the past.
Choose to soar to pursue a career in dance.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation, and Stockton University. This edition of Latino Motion with Bert Lopez is brought to you by the HD Studios at the campus of Stockton University.
Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. AtlantiCare has recently begun its new Centering Pregnancy program. With us today to discuss more about this important program is Dr. Nicole Sims. She is with AtlantiCare. Doctor, welcome to Latino Motion.
Thank you for having me.
So centering during pregnancy is very important. There are very good reasons for doing so. I want to know more about the meaning of what centering is, but let's discuss the problem that we have, particularly for women of color around pregnancy. Tell me a little more about some of the issues.
So studies have shown that there is a real health disparity when it comes to Black and Hispanic women, that there are increased rates of maternal mortality. In fact, in the state of New Jersey, we rank 47th out of 50 states in maternal mortality, and focus has really been put on ways to improve this. In addition, women of color are at increased risk of preterm labor, having low birth weight infants, and increased infant mortality as well.
Let's talk a little more about that. And I just read some data. Actually, the First Lady of New Jersey, I know, has been very active in this program and raising awareness. But for Hispanic women, it's 2.7 times greater the risk of death than white women. And for Blacks, it is 7.6 times greater. So that's significant. Do we have any information as to what causes that disparity?
So there is some information. It appears to be that almost 9 out of 10 cases of maternal mortality are preventable. And a lot of those preventable cases are related to lack of knowledge, either on the patient or the provider providing care, as well as some unconscious bias on the part of the healthcare system.
Yeah, and talking about the unconscious bias, which is important, access is very critical, having that warm and welcoming environment. You feel that this new program that AtlantiCare has instituted is going to provide that caring environment to attract more women that are pregnant to seek services.
Right, so one of the core components in developing centering were addressing inherent biases in healthcare. And by empowering women to be in control of their healthcare and support each other and be the driving force behind seeking knowledge about their pregnancy and their bodies during that time period, that seems to address some of these concerns.
And you also mentioned the premature babies. I know my son was premature, and it's a very scary time for parents when you have a child that doesn't go through full term. And what are some of the things that the centering program is going to do to help alleviate or reduce that statistic?
Right, so some of that goes back to, again, knowledge, knowing what signs to look for. Presenting to the hospital sooner can allow for intervention sooner, which can affect some of these outcomes. The other aspect is that a lot of women who experience preterm birth may not have as much access or consistency with their care, and centering creates a warm environment that ensures the correct amount of access to the care needed.
Yeah, again, access so very important, right? Getting the access at the right time and following through. Let's talk about what the nuts and bolts are really of the centering program. What do we mean by centering and centering pregnancy?
Right. So centering pregnancy is a group model of care that's shown to address some of these health disparities. It's really designed to put the patient at the center of their care.
That's why it's centering, right? You center around the pregnancy. And is this a special visit? Is it an actual program that the pregnant women get enrolled in?
So this is actually taking routine prenatal care and expanding on it. So rather than their 10, 15-minute visit with a provider, this is a 2-hour session that covers that basic care, as well as increased information about pregnancy and childbirth, and support from other women experiencing the same thing.
So I guess what you're saying is it goes beyond you yourself as a doctor and the pregnant woman. You actually put a lot of services around her to be able to have a successful pregnancy.
Absolutely.
Let's talk about the benefits. Obviously, you mentioned the statistics and what we're trying to alleviate. But let's talk about the benefits for those who are enrolled in the program.
Sure. Centering pregnancy empowers women to be in control of their own health and to seek care and knowledge where needed. There are a lot of patient pleasers with this program as well. All of the sessions are mapped out in advance, so patients know exactly when they're coming. There's a start time and an end time. We start on time and we end on time for those patients. It also allows patients to see the same provider at each and every session. Now, some patients may have more complicated medical histories that require additional visits, and that's kind of structured in as needed. Those visits can be scheduled, and our patients routinely see our maternal fetal medicine specialists for ultrasounds. All of that care that you would expect with routine care is there as well. This is just adding to it.
Now, one of the things that, particularly with the Hispanic community, which obviously the culture, language are factors, is that also taken into consideration?
Absolutely. We actually have a team that's working on doing this initially, and we hope to expand as the program grows. But one of our medical assistants and one of our midwives are Spanish speaking, and we're hoping to, in the very near future, explore options for having Spanish speaking groups, and also to kind of look at our patient population and see if there are other languages that we should be trying to offer this in as well.
You mentioned groups, so I'm assuming that there's also, beyond the visits, there are other group settings that you treat and give information to the women?
Right, so the visits are actually a group setting.
Oh, okay.
So they're set up to be about 2 hours. The first 30 minutes of that session involves one-on-one time with the physician or midwife to listen to the baby's heartbeat, address any other concerns. But the 90 minutes is then in a group setting where women are able to ask questions that they have, and there are different topics from session to session. Very early on in the pregnancy, we discuss like common pregnancy symptoms and what we can do to alleviate those. There are also sessions on childbirth, breastfeeding, nutrition.
The old saying, it takes a village. Certainly, I would assume that when you have other pregnant women together, that they could learn off of each other as well, and you could really get some of the issues that they're going through and could relate to.
Right. I mean, my role as a physician is, of course, to be a source of knowledge for my patients, but really with centering pregnancy, I get to facilitate. So I get to sit back and allow women to to support each other and encourage each other and provide each other with information. And I'm really just there to kind of guide the ship and encourage those kind of interactions.
So pregnant women that want to enroll in this program, how do they go about it?
So right now the program is offered to all women who are existing patients with AtlantiCare OBGYN physician group. They can get more information by going to atlanticare.org/centering or by emailing CenteringPregnancy@atlanticare.org.
It's a hope that it will be expanding to others.
Absolutely. Any patient who has insurance that is taken by the group at this time is certainly able to become a patient of the practice. We are also looking for ways to expand the program beyond that.
Well, we're going to continue this discussion. We've got a lot more to cover. We'll take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
The case for DEI as it relates to fairness, I think is equally important for a company like PHI. So of course there is that business case that, a diverse organization is going to be at the end of the day more profitable. But the other piece of it also is that when you have that kind of company culture, you adopt it and you're not just talking about it, but you're really genuinely walking the walk like PHI and Atlantic City Electric is. Your employees are going to feel that. They're going to sense that. They're going to see that every day. And they're going to have a greater sense of belonging in the company in which they work. And hopefully that'll make them want to continue to stay with the company, develop, and make the company's current culture even better than it is, and therefore strengthen the business as well.
Welcome back to Latino Motion. We continue our discussion with Dr. Nicole Sims with AtlantiCare. And we were talking about the centering program, the pregnancy centering program. Very important program, particularly to address some of the health disparities that exist for women of color, including Latinas. And obviously, the medical staff, all the folks that are associated with this program are very important. I want to know the impetus of the program itself, and I want to get a little information on yourself.
Sure. So I've been with AtlantiCare for about 3 years, and it feels like shortly after I started, Sandy Garrett, our Associate Vice President for Women's Health, was looking for someone to really champion this program. And having wanted to be an OBGYN since I was 16 years old, I always found it important to have women helping to take care of women, and anything we can do to really help women take care of themselves has been important to me. And so this seemed like a great opportunity to really help and reach out to women that may need a little extra hand throughout the course of their pregnancy. And so we were very fortunate to go to kind of our staff and really ask who wanted to be a part of this program. And we're hoping that we had more people interested than we were able to start with. And we're hoping that this is the start of really an explosion of this program for AtlantiCare and Atlantic County.
Very important that you have willing staff, right? And the program itself is not new, right? It's been around for a little while. Tell me about that.
Yeah, so centering as a model for prenatal care actually started about 20 years ago. But in conjunction with the First Lady of New Jersey's push for maternal health, we've seen an explosion in programs throughout the state. We actually partnered with the Burke Foundation, who gave us a grant that we're using as a startup for this program, and we know they've done that in other places throughout the state as well.
So we were talking about women do enroll, right? You basically take any insurance, including Medicaid, and those that get enrolled, all of their sessions will be taking place in Atlantic City at the Medical Arts Pavilion.
Correct. AtlantiCare is always looking for ways to optimize health for our patients, and we did feel that there was a need in Atlantic City to have better access to care, and so they recently opened a brand new medical arts pavilion on Ohio Ave, and we are fortunate enough to have dedicated space in that building for our program.
Yeah, it's certainly exciting that you have a brand new place with a brand new program, well, brand new for AtlantiCare to help women, particularly overcome these health disparities. Walk me through a little bit about the sessions. What are some of the things that women could expect to learn about their pregnancy and why that is so important?
Right. So, patients will show up on time. Part of that initial evaluation involves doing everything we would do with routine prenatal care. So, obtaining a weight, obtaining a blood pressure, checking a urine sample, listening to the baby's heartbeat. Centering is a little different because we actually teach women how to do some of those things for themselves. So throughout the course of their sessions with centering, they'll be taking and recording their own blood pressures, tracking their own weight, really giving them information. Our centering coordinator, who's been working with us through the program, actually has come out and said, when was the last time you went to the doctors and they took your blood pressure? Did they actually tell you what your blood pressure was? Well, it's important to know that information because you can't make choices or decisions about your care if you don't know what you're trying to affect.
So certainly giving them those very valuable lessons is important. Tell me in terms of the interaction, right? It's a group setting. I would think that, maybe some women are a little more reserved and don't want to share in front of a group. Why is that important in terms of the group session?
Well, I think that the key to the group session is sometimes for those women who are maybe uncomfortable sharing because they're all experiencing the same thing together. And so someone may mention something that may be related to what you were concerned about, and you can build on that without having to be the person that speaks first. And while, we do share as a group, our exam room space is attached, but a little bit separated from the space, and there is still that one-on-one time with the provider. So if a patient's uncomfortable maybe sharing in the group setting, as the facilitator for the session, I can bring some of those concerns up and allow them to be discussed without someone having to be put on the spot.
So let me walk me through what happens after the baby is delivered, right?
Sure.
You go through this centering program. Is there any follow-up once the baby is born? So
we do a bonus postpartum session. At AtlantiCare, we've decided to really focus on the postpartum period, and rather than just one traditional postpartum visit, we're now doing two. And so one of those sessions will continue with the centering program, but our federally qualified health center for pediatrics has also decided to champion a centering parenting program. And so patients have the option of joining that program as well, where they will meet in a group setting again with babies all around the same age for the first 2 years of life for their routine care and have the same sort of experience beyond just the pregnancy.
Yeah, so it's great that now you have the centering during the pregnancy, and you may also have the centering once the child is born. And those services are all offered at the Health Pavilion?
Correct. They're all at the Medical Arts Pavilion in Atlantic City.
You want to give that information again for individuals who want to participate in the centering program. Right.
So for patients who are interested, they can go to the AtlantiCare website, atlanticare.org/centering. They can also email CenteringPregnancy@atlanticare.org or CenteringParenting@atlanticare.org for additional information.
You mentioned the First Lady, Murphy, in terms of her involvement. Are you partnering out in the community with other groups as well?
We're certainly reaching out. We work with a wonderful educator in our family planning clinic who has lots of ties to the community in trying to spread knowledge about the program, as well as, of course, through our marketing department at AtlantiCare.
And I know AtlantiCare has reached out through the NAACP, the Hispanic Association, in terms of getting the word out. What other things do you think are important for AtlantiCare to participate in? And if there's an organization that wants to partner with AtlantiCare and getting the word out, how can they do that?
They certainly, I have access to all the emails through those email address, so
Okay.
they can certainly reach out to us through those email address. We would be definitely interested in entertaining any community support for the program because we believe that's vital to the success of this program.
Talking about success, do you have an example of some feedback from some of the ladies that may have gone through this program, maybe not AtlantiCare, but in other programs?
You know, it really is a big community and support builder. You know, with the pandemic, people have become really isolated, and certainly pregnancy and the immediate postpartum period kind of builds on that isolation. And so there's been a lot of feedback about just having that support that they didn't necessarily know they needed, but ultimately discovered they wanted. We also have snacks, and we know
always a big attraction.
yes, that's right. The key to people's hearts is through their stomachs, but we have snacks at every session as well, and that just food I think brings people together.
That's great. We want to talk a little more about this because there's a lot of useful information here for pregnant women who want to get involved, but also in generally for keeping a healthy baby. It's very important. We're going to take a quick break. We'll be right back with more Latino Motion.
The case for DEI as it relates to fairness, I think is equally important for a company like PHI. So of course there is that business case that, you know, a diverse organization is going to be at the end of the day more profitable. But the other piece of it also is that when you have that kind of company culture, you adopt it and you're not just talking about it, but you're really genuinely walking the walk like PHI and Atlantic City Electric is. Your employees are going to feel that. They're going to sense that. They're going to see that every day. And they're going to have a greater sense of belonging in the company in which they work. And hopefully that'll make them want to continue to stay with the company, develop, and make the company's current culture even better than it is, and therefore strengthen the business as well.
Welcome back to Latino Motion. We continue our discussion with Nicole Sims. She is with AtlantiCare and again, talking about the Centering Pregnancy program of AtlantiCare. We want to give that information out once again. Anyone that wants to participate, it's a very intensive program and certainly one that's very important for Latinas and women of color who have significant health disparities when it comes to pregnancy. Let's give the contact information once again.
Sure. They can get more information on our website, atlanticare.org/centering. They also can email centeringpregnancy@atlanticare.org.
A big tie-in to the centering is also family planning. Tell me a little bit about what's being offered at AtlantiCare as far as family planning is concerned.
Sure. So centering includes topic focus at every session, and one of those is, of course, family planning. And studies have shown that with patients who participate in centering planning, they're much more likely to take part in postpartum family planning services. We are lucky enough to be located on the same floor as our family planning clinic at AtlantiCare, which is now full-time 5 days a week out of that facility and takes patients with or without insurance. They offer screening for sexually transmitted diseases. They offer pap smears. They offer all forms of contraceptions, including long-acting reversible methods of contraception such as implants and intrauterine devices.
So it's very comprehensive, certainly. Let's talk about the other issue we talked about once the baby's born, right? They get an opportunity to also get the clinic there at the health pavilion. What kind of services do they offer for the newborns and younger children?
Right. So our federally qualified health center in pediatrics does offer routine newborn care and pediatric care, of course. But they will also be offering centering parenting. So it is, again, a 2-hour session with babies all due around the same time. They actually, it's really kind of neat to see. They gather with the adults in a circle and kind of allow the kids to kind of interact with each other there on the floor.
Okay.
A lot of times the exam or the wellness check is done right there in the group space, and it gives the parents an opportunity to talk about any concerns they have and learn about appropriate development as their baby grows and changes.
Now, nutrition, particularly for Latinas and women of color, during the pregnancy, after the pregnancy, is very important. Tell me why.
It's really important to know, one, what is healthy eating, but also in the context of what is cultural eating, right? So, everyone has foods that they love, and it's not about healthy versus not healthy, but maybe healthy versus healthier. And what is providing your body with the nutrients you need to help grow the best pregnancy and the best baby for care.
As parents, young parents, I know they're always concerned, maybe their first baby, when they see signs. So during the pregnancy, what are some of the signs that pregnant women should look for, particularly, when they're having an issue? Do they go to the emergency room, or when is the appropriate time to go to a physician, et cetera?
Sure. So, patients should always feel comfortable reaching out to their provider, no matter what concerns they have. But certainly if you were experiencing any bleeding or cramping during pregnancy, that would be appropriate to make a phone call. Our practice, you can always reach a live person 24 hours a day, 7 days of the week, and there is always someone on call for the practice. And so patients should certainly feel free to reach out if they're experiencing symptoms that are concerning to them.
And let's switch that to newborn and young children, whether it's a cough or the child has a fever. When is the appropriate time to seek medical attention?
Again, there is something to trusting your instinct as a parent. And if there's a problem that's concerning to you, it's important to reach out and have that information addressed so that you know what's going on. And you can do that by making a phone call to your provider. Usually there are nurses available to help any questions, but certainly, anything that's life-threatening should be addressed to the nearest, more urgent center.
So you mentioned the FQAC, and obviously the pediatrics is part of the FQAC, which stands for the Federally Qualified Health Center. That allows patients to really receive services there, even if they don't have insurance or basically are not able to pay. Is that correct?
That's correct. And those services are offered for family medicine, pediatrics, and also our family planning clinic.
And one of the things, and just from my own personal experience, my son I mentioned was a preemie. And one of the great things about AtlantiCare is the Center for Childbirth. It's just an amazing team. And you have a level 3 ICU. Tell me about that.
Yes,
NICU. Right.
Correct. So our NICU is level 3. It allows us to care for babies as young as 24 weeks when they're born, up until full term, and is really able to provide comprehensive care to them when they're really little and determined to make their way in this world.
And it's very reassuring for parents. I know the traumatic experience that I, as a parent, when my child was premature. It's a very scary time, right? You don't know what's going to happen. They have these tubes, but certainly having that care is so critical, and having those understanding staff members there to provide those really important services. Dr. Sims, I know that you indicated you're here in AtlantiCare for 3 years. Tell me about your former practice.
Sure. Prior to joining AtlantiCare, I was in private practice in Central Jersey, and ultimately made the move down here to be able to provide excellent care and spend a little bit more time with my own 2 children, who are going to be 5 and 7 next month.
That's wonderful. So certainly welcome. It's 3 years. I guess you're already accustomed to this area, so certainly welcome you, and you're an important addition to certainly the health team here in AtlantiCare.
Thank you.
Thank you so much. And unfortunately, that's all the time we have. Thank you for joining us.
Thank you for having me. I really appreciate it.
And thank you for joining us once again here on Latino Motion.
Choose to get your feet wet, to learn more about protecting our environment.
Choose to read minds, to understand the human brain.
Choose to get your hands dirty, to create a masterpiece.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit AtlantiCare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.